It looks like we have pretty much all of our students in here. We're going to go ahead and get started to get some time saved. So, hey students, I just want to say welcome to Baylor Premier. Thanks for joining in on the public health session today. We actually have Dr. Beth Lanning. She is the Associate Chair of the Department of Public Health, and she's going to tell you guys a little bit more about Baylor's public health program here. And yeah, without further ado, I'm going to go ahead and hand it over to you, Dr. Lanning.
Great, thank you. Let me know if you can hear us okay, and if you can't, just put something in the chat and let us know. So I am so glad that you decided to join our presentation and learn a little bit more about public health. It is a great time to think about public health as a major. As you know, public health has been in the limelight this whole past couple of years, or a year and a half now, it seems, with COVID. So there's a lot of changes and a lot of exciting things that are going to happen for our profession. So it's a great time to think about coming into public health. My name is Dr. Lanning, and I am the Associate Chair, and I used to be the undergraduate coordinator for over 13 years, but Mrs. Margo Shanks is now your coordinator. She was not feeling well today. I apologize for not being able to present this, but I have all of her contact information. But she and I work together a lot. So I want to go ahead and get started on what is public health. And so let me flip to a real quick YouTube clip from the American Public Health Association. And you can kind of learn a little bit more about that. Give me just a second for it to load.
Public health is a vaccine that prevents disease.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, we introduced prevention and early detection activities that helped increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution. And the Flint, Michigan lead crisis taught us the dangers of our aging water systems. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty and their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges will require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and businesses.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP, and the Affordable Care Act as steps to quality and affordable health care.
We advocate common sense measures to reduce gun violence. We can reduce gun deaths in the same way. We partnered with road planners and car engineers to address auto fatalities.
So what is public health? It is all of us, working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHA as we create the healthiest nation in one generation.
So that kind of gave you a little bit of an idea about what is public health. Let me go forward and talk a little bit more. So what they mentioned in the video is that public health really focuses on the whole community. And so it's not a one-on-one like the medical model. We do work with one-on-one individuals, but we also work from a community perspective. So we look at the whole community and what are the conditions that affect a person's health, the health of their family, and the health of the other loved ones in their family and extended family. So it's a very, what we call systems thinking type of way of approaching it. So if we think about what has the biggest impact, and so I think it's kind of interesting to look at this particular diagram here. You can see at the very top is the smaller impact, and then towards the bottom is the larger impact. So in public health, we look for how to get the biggest bang for our buck, if you will, some way to look at how can we make some small changes or big changes that will affect a lot of people. And we can do that by addressing factors such as poverty, education, housing, inequality, social justice, looking at some of those elements. And then also from that comes people's decisions to be engaged in healthy behaviors. But you can't make those decisions if you don't have those opportunities. And so we really focus on that, the aspect of the obtaining health. And so while counseling and clinical intervention is extremely important, and we work hand in hand with our partners in the healthcare system, and some public health professionals will go into medicine as well, we realize that that is treating the person after that they have the disease. And so we really want to work more preventative. And yes, they do preventative screening is important as well, but we really work on that big systemic issues that address or that affect someone's health. I'm going to go ahead and go forward because we have a couple other videos, but it's going to take too much time. And I want to make sure we have enough time to talk about your questions and answer your questions. So public health specialists are trained to do several things. We're trained to act in partnership with healthcare workers. So we work with the healthcare systems. We work outside of healthcare systems. We really think about the big picture, and that's what's so fun. I tell my students all the time, the most important question you can ask is why? Why? Just because you see that someone has a higher incident of diabetes, you want to ask yourself, why is that occurring, and dig down. I call it peeling the onion. You just keep digging down further and further to figure out what is the root of the cause. Because most of what we see is a symptom. We don't see the cause. We see the symptom, like diabetes, it's a symptom of something else. And so it's important to kind of think about that big picture. We treat the person not as a patient with a problem, but a person with a life. And so we think about all those other things that are connected to that person that affect their daily decisions about their health decisions. Because we really look at health as a right, not as a privilege. And that's something that's kind of an important paradigm. So we think about the systems thinking, and system thinking just means that everything is connected to everything. And I think the COVID has actually taught us that and has magnified that even more. We noticed that we had a disease that we're still dealing with, and it affected our educational system. It affected our economic system. It affected our businesses. It had a ripple effect. And that's that systems thinking. Everything you do in one area affects another area. We promote self-management and empowerment. We really believe that people have a choice to engage in healthy behaviors. We want to make sure that that choice is available to all. And that's a critical piece. But once that person has given that opportunity, we want them to be able to take that opportunity. And so we help to empower people to do just that, teaching them how to navigate the healthcare system or how to engage in healthy behaviors is part of what we do. So public health educators on the job, where do we work? That's what everybody wants to know. Can I get a job? Yes, you can get a job. And that's a great thing. Right now, the job market is going to be very, it's increasing basically right now. So our health educators work in healthcare systems. They work for nonprofit organizations. We work in public health institutes, such as like the Department of Public Health, or not department, but the health district, like McLennan County Health District and your other local city health districts. Private businesses, a lot of them are also hiring health educators and public health specialists to work as health coaches for their employees. They also may be in business to promote different kinds of health types of products. We work in schools. Some of our graduate students, our students that graduate from our program, also work in schools as liaisons, health liaisons between the school and their communities, but also working within school districts. You are not trained as K through 12. You're not trained as an instructor. We don't have that as part of this. This is not an education degree. It is a public health degree. And again, there's another clip. A lot of these clips are actually on our website, our public health website. And so you can go back to them. If I have time, I'll come back, but I want to go forward just for a minute. So let me talk a little bit about the degree, and then I'll come back as I want you to see Mrs. Shanks' face, because that's who you'll be talking to quite a bit as you think about this as your degree. Our degree plan is 124 semester hours. That's fairly typical for Baylor degrees. You will receive a Bachelor of Science in Public Health. So it's a very specific degree. This is a degree that is recognized nationally. So it's not something that some people worry, well, is it a Bachelor of Science and then you get public health? So no, it is a Bachelor of Science in Public Health. So we have an undergrad degree. We also have a master's program. We actually have two master's programs. We have one that's on campus, and then we have a completely online MPH program. The one that's on campus has 3 concentrations. So you can specialize in epidemiology, community health, or environmental health. And that is a 2-year program. That's fairly standard across the nation. All MPH programs are 42 hours. There are, in that master's program, we do have some scholarships that are available for covering your tuition or most of your tuition. And there's some different positions that are available for thinking ahead. I know you're thinking you're undergrad right now, but are moving that direction, but it's never too early to think about your master's program. And then we also have a joint program. This is at BSPH and MPH in 5 years. And this is something that some of the students have chosen to do. We typically have about 2 to 3 students each year that start the master's work as both an undergrad at the same time. They're in this BSPH program or 5-year program. And the way this works is you spend 3 years, the first 3 years, completing most of your undergrad work. And then you matriculate into the master's program, and you will start to work on some of your master classes that will double count for both your master and your undergrad degree. This degree, if you want to pursue this, there's some caveats and some things that Mrs. Shanks will need to talk to you about to make sure that you are eligible to do so. And it is only for the community health concentration. So if you're thinking, I would like to get a master's in epidemiology, then you would not be able to do the BSPH, MPH 5-year program. So that's something just to kind of think about. So there are ways you can connect, and I would really highly recommend that you friend us on our Facebook page and follow our Instagram, because you'll see that there's a lot of things going on. There's jobs that we post on there. So you get a feel for what are the students doing, what are the opportunities for students when they're here at Baylor. And so those are kind of important to make sure you're connecting early with us. I've got just a few minutes, so let me go back. Let me make sure Mrs. Shanks' information is on the screen now. So make sure you jot that down. You can email her, you can call her, and then there's also our website, and I really encourage you to look at our website as well. Let me go back and show you, her YouTube clip so you can get to see who she is, and then we'll open it up for questions and answers.
My name is Margo Shanks. I'm a senior lecturer in the Department of Public Health. I also serve as the undergraduate program director and the internship coordinator.
The Department of Public Health is housed in the center of campus. With students coming from around the world, we hope that they find themselves home here at Baylor and our program.
It is very important to us that we create a community both in and out of the classroom. One of the ways we do this is that we have small class sizes. This allows for us as instructors to get to know our students on a one-to-one basis, not only who they are and what their names are, but what their passions are.
We have also adopted a cohort model. In this model, students go through a series of core classes together. This model is great not only for classroom instruction and discussion, but it often leads to strong relationships among classmates. It's one of my greatest pleasures to see those relationships form throughout the year. Not only are we intentional about our classroom communities, we're also very passionate about the communities we serve. Many of our assignments, projects, and experiences
often include partnerships with local organizations. Our Intro to Public Health course provides an opportunity for students to be in the community in their first semester as a major. Our students are tasked with creating a health fair for a local nonprofit called Church Under the Bridge. Students are responsible for creation of various educational booths, and many students have reported that this is their favorite experience of the whole program. Being in the Waco community is a high priority for us. You can find us working with the Family Health Center, the Waco McLennan County Public Health District, and many other nonprofits in the community. Because of these relationships, we're often able to place students in these community settings for projects, assignments, internships, and practicums. And though we love our Waco community, we are aware that the public health field often has communities domestically and globally. Our faculty are involved in research, projects, and education throughout the world. While some are speaking at the UN, others are doing research in Africa. You can find our study abroad program in Brazil every summer, or you can join us on a mission trip to the Dominican Republic or Africa.
The information that happens, that the people give out, and especially for the girls here and the guys, they're all really friendly, very helpful. I haven't met someone who turned you away, or everyone's wanting you to come to their booth and stuff. That's what I like about it.
See what's going on, see what's giving back to the community. See what the young crowd, the young nation is doing for us. Not only fulfilling their achievement in life, but just to see the joy and happiness that what y'all bring to help the community alive.
The one word I would use is the word that I love that they use in Harry Potter. Brilliant.
Overjoyed.
Exciting.
I think it's pretty awesome. The word that I would use to describe this experience is gratifying.
Surprising.
Eye-opening.
Eye-opening.
Positive. Different.
Unique. Completely worthy. Share. Exciting.
Humbling.
Friendship. Fairness. Happiness. Community. Heartwarming. Grateful.
Love.
Inspiring.
Fulfilling. Life-changing.
Opportunistic.
With a faculty with diverse interests and research areas, this provides students an opportunity to connect with professors who have similar interests. We also encourage students to get involved with student organizations on campus and within our department. The Department of Public Health will not only provide you with a quality education and unique learning experiences, it will be a community where you will be seen and known. So come, join the public health family and sick 'em bears.
So at this point, I would like to go ahead and make sure I can answer your questions. So I'm gonna stop sharing my screen. And I'll go ahead and, Poppy, do you want to read those questions to me, or that'd be work? Okay. Great.
Sure, I can do that for you.
Okay.
So looking at these questions, we have Diamond asked, will she be able to double major in public health and health science studies?
The answer is no. You're going to have to choose between those two. We often have the health science studies majors. Some of them will switch over to public health. I love the health science studies major. I think it's a phenomenal major in prepping you for pre-PT or pre-med. But I just want to kind of put a plug in here for public health, that a public health major is highly, highly recognized and valued by medical schools. It is probably the #1 major for helping students get into medical school. So if you're thinking about this, you're going into medical school, you can still major in public health and complete your pre-med requirements. The requirements are not completely built into the whole program, so it will require you to perhaps to do some summer work, unless you're coming in with a lot of credits. And a lot of our students are coming in with so many credits from high school that you'll have opportunities to be able to complete your pre-med requirements while completing your BSPH and still do it in 4 years. And so just something to think about, but no, you can't double major.
Okay. So now we have Shreya. How hard is it to get into the BSPH MPH 5-year program?
Couple of things you have to think about. One is that your GPA's needs to be high enough. It needs to be at least a 3.2. So we can't decide that until you've been in the major for a few semesters. And then you'll also be required to take a GRE, which is a little bit later into your work, probably by about the 3rd year of your work. The GRE is the kind of the graduate equivalent to an SAT or an ACT. So just give you an idea. If your scores are higher enough and you have a 3.2 and you've been following this very specific degree plan for the joint program, then you are usually accepted into our program. So a lot of it is just depending on your scores and then also how it fits into your overall degree.
Awesome. So now we have Annie. Can you talk a little bit about how you incorporate global health into your courses?
Yes, the neat thing is that a lot of our faculty, we work domestically and we work internationally. So we bring a lot of those opportunities into the classroom. As was mentioned on the video, we do have a mission trip to the Dominican Republic. We actually connect with the pre-med group and we work together with them. So it's public health and the pre-med students. We also have a Baylor in Brazil program that's a 6-week program in the summer. And then I lead a global health was in Zambia, but we're switching it over to Rwanda because our college, the Robbins College, has a working agreement with African New Life. And I'm in charge of actually that program and helping to connect with our partners in Rwanda. So we're hoping to offer more opportunities. We have other faculty that work in Ghana and work in Somaliland, which they don't actually go to Somaliland, they work from abroad on that one, but others are from Ghana and working in Ghana. So we have a lot of those opportunities to work on projects, or we bring that information in, and then you have opportunities to join us on some of these trips as well.
Awesome. Jaden asked, are there any internship opportunities?
Yes, internship is required for the major. You will complete, as part of your requirement, you will complete an internship of 320 clock hours. It's worth 6 credit hours. You'll do that the last semester or towards the end of your time. So that is a requirement. And that is a great experience because, well, let me give you an example. It's also a great launch to getting a job. One of my students right now in undergrad, she did her internship at CareNet. She worked for a supervisor who was overall health education within CareNet, and her supervisor was resigning from her position for her own personal reasons and said, you would be a great person for this position. So she applied for it and she's hired before she's graduated. So she's very excited. So she has a job before graduating, yes. So your internships can lead to jobs, but they can also lead to contacts. And of course, they're phenomenal for your resume. So they are required, so you get great opportunities.
Awesome. Annie asked, is there anything special to work with pre-med students?
No, we just need to, Mrs. Shanks will need to know that from the very beginning and just make sure that your pre-med requirements are in there. Some of them will double count. For instance, we require in our major I'm just drawing a blank, the anatomy class and the physiology class, the human physiology class and anatomy class. That's required for our major, and it's also required for you as a pre-med student. So you would take the bio version of that, in biology version, so that you have that bio prefix on your transcript to go to medical school. But it would also, that class would count as part of our degree. So there's those kinds of things that need to be made sure we take care of, but it's a very seamless, easy process so that you can go on and be very marketable. If you're remarkable, you may think about a master's in healthcare administration. I had a student that is applying right now, and he went for his interviews for the master's program, and the interviewer was really excited that he had a public health degree, and said, he told him right from the beginning, said, well, this puts you above other interviews. So.
Awesome. So your next question, Stephanie asked, how many students are there in the program?
Great question. We have about 150, 160 majors. They're all in different levels. So, but that's about how many we have in the program.
Awesome. Another question by Shreya. Are we allowed to minor in biology as a public health major?
You can pick up a minor. It just takes you a little bit extra time. So it would depend on, again, what your time frame looks like. Some people have to get out in 4 years for sure. So, but you can, if the minor is available, you can minor with taking the major.
And our next question, Etiana asks, any opportunities to serve in Mexico?
We do not have any of those at this point. Not that that couldn't occur, but we don't have any programs that I am aware of. You could check through our Center for Global Engagement. We have a center on college campus that anybody can go to Global Engagement and look at for different kinds of mission opportunities. And you can do that regardless of your major. So there might be other missions that go to Mexico that I'm not aware of.
Hey, awesome. We are almost out of time, but we do have one more question. Are there any majors that you can double major with public health?
No, we don't offer any double majors at this point.
Okay, well,
it would extend your time way too long.
That is completely understood. Well, I'd just like to say thank you, Dr. Lanning, for coming and speaking about the public health program, and to all of our students today. I want to thank our students for joining in. And so you guys have time to get to your next session. Thanks for joining. You guys have a great rest of your day.
Thank you. Bye-bye.
Bye.